Welcome. I'm Cheryl Mitchell, the president of Tree Levin, Retreat and Learning Center here in the Champlain Valley, and it's been our immense privilege over these past few years to partner with Building Bright Futures to produce this show, which really looks at what's happening in the early childhood world in our county and beyond. And today we're very pleased to have as our guest Dr. Morgan Crossman, who's the new executive director of the statewide Building Bright Futures. I think all of you know Darla Senecal, who is our regional representative here. So thank you very, very much for joining us. We really appreciate it.
Thank you for having me.
Anxious to have you here at the station to hear about your background, hear about the work that you're doing, hear about your dreams for the future. And I thought it might make most sense to just start by having you give us a little bit of an overview about Building Bright Futures statewide and what you're hoping to accomplish.
Sure. Thank you so much for having me. I really appreciate it. It's such a phenomenal opportunity to come and talk about our work and talk about our work in the regions and how that really informs our statewide ability to have a collective impact model to work on behalf of kids and families. So thank you. I think it's important to start by saying that, we are at Building Bright Futures, both state and federally mandated to lead the State Advisory Council on Early Childhood. So our role is to be that SAC. And in that way, we're really working to improve the well-being of children and families across the state using a multiple pronged approach there. So it's our responsibility to serve as a neutral convener and to really bring together all of the key stakeholders in different service sectors and provide opportunities for their voices to be heard at different levels. I think it's also important to monitor the system of services, right? So we use our early childhood action plan as one way of doing that and trying to identify what are the needs of kids and families statewide and how do we improve their well-being. And then the last piece of that is using data to inform policy, right? And advising the governor and the administration on what's the current status for kids and families in the state of Vermont.
You have a very active website that people can turn to find data. Do you want to tell us about that?
Sure, yes. So we use Vermont Insights as our public-facing data platform, and that's actually a part of my vision for the future of BBF is really building our capacity and our recognition as being the organization that both identifies and utilizes the most up-to-date, high-quality data to inform policy and service provision for kids and families. So we're really working on collaborating with key partners regionally and at the agency level to say, in your specific area, in your service sector, in your program, what are the top 3 indicators? What are the top 3 things that would tell us how kids and families are doing? Do we have the data to inform that right now? Or is that a data gap and something we need to be talking more about? If we do have that data, how can we help promote that? How can we be a conduit to helping families and kids know, but also providers and state agency leaders what that data is and how can we help you in putting that out?
Can you tell us some of those top 3 things that you're hearing?
Sure. I think it depends on the different service sector, right? But if we're talking about our mental health partners, for example, in our new flagship report that's coming out in January, How Are Vermont's Young Children and Families, we've created a mental health spotlight to say, given the State Advisory Council's priority this year on mental health and then also workforce, what are the top things that we need to have people know about kids and families in the mental health arena? And one of the things there that we're really focused on is the number of kids who have social, emotional, and behavioral concerns at the different ages. So one of the key things that really sticks out in my mind right now is that 1 in 5 kids in the ages of 6 to 8 are appearing in the state of Vermont as having a social, emotional, or behavioral health concern.
So how does that show up? Is that because they're on an IEP with that concern, or because their parents are seeking help?
It's a great question. I think a lot of it is seen in our education data, but also in our mental health data saying, is this child on an IEP? Are they expressing anxiety, depression, behavioral concerns? I think there's a lot of different ways to measure that. And that's what we're really working on with our agency partners is how do we do the best job of characterizing our kids and families and knowing where we need to dedicate our efforts? What does that look like? And are these families in crisis, or are these families, are they actively receiving services? And how can we support the system to better do that?
Wow. And is it different region by region, or are you saying this is a concern across the state?
I think it's an interesting question. You know, I don't know that we have the data to say by region, this is what it looks like, and this is how we need to manage differently. I think right now what we're working on is saying, as a state, we recognize that this is an area of concern. This is an area we need to be paying attention to, and how do we best support kids and families? I would love to see us moving in a direction of being able to say, okay, here is our state level indicator, and here's how it varies by region, and how can we best support kids and families. I think we've started to collect that data, but I think we're moving in the right direction at the very least.
Yeah. It's exciting that you're paying attention to it. When I was working in the state agency, we were routinely collecting a lot of data and feeding it back to local communities, and then it fell away, and it's very heartening to think that you all are taking that up again.
Yeah.
I'm curious about when you say there's going to be a spotlight on mental health this year. How do you, as a council, come to decide what, is it going to be housing? Is it going to be childcare? Is it going to be mental health?
Yeah,
How do you figure that out?
That's a great question. So we have an annual cycle for determining priorities annually, and that really starts with our regional council tables. So when I come to sit with Addison, and when Darla or other people come into the communities and say, what are your top needs? What are the priorities? What are you seeing happening on the ground? And identifying those first regionally and locally, then we take that information and we bring it to the State Advisory Council, and we say, these are some of the things that we're hearing. Do we have a consistent message across our regional work, or is it specific to any one region? And what we've seen consistently over the last couple of years is the fact that we need to focus on mental health. And what does that mean as a state? What does it mean in the regions? We've also seen that same topic come up in workforce across the state. And so there is a more rigorous...
In that there's not an adequate workforce, or they're not prepared, or...
That we really need to be focusing on workforce as a key area, especially in the area of our early childhood work at the different levels. And what does that mean? And how do we support the statewide infrastructure to be thinking about workforce development and capacity to serve the growing needs of our kids and families, right? And so I think what's interesting is, once the state advisory here are all the different things that are happening, what is our focus, and how do we have a collective impact process to say, yes, this is our next step, this is our priority for this year. So as a state advisory council, we come to that conclusion through a consensus voting process, and then we initiate through our early childhood action plans work around our committees to again, over the course of that year, be figuring out what our action steps are to move that needle. And then at the end of that year, what you'll see is recommendations come through the State Advisory Council, but also in our How Are Vermont's Young Children and Families report on those key topic
Which you've
areas.
been doing for years, right? I mean, not you personally,
Yes,
but
yes,
Bright
the
Futures.
organization, yeah.
You mentioned at the very beginning that it's both a state and a national group in some way. Can you talk about what those national... I know that it's required somehow, but I'm not exactly sure I could articulate how it's required.
Yes. So the Building Bright Future State Advisory Council, when I say, is both state and federally mandated. We are state mandated under Act 104 to be the State Advisory Council, but also through the Federal Head Start Act, right? So we have a federal Head Start mandate to also be doing this work. And so in that way, we have three key roles, as I mentioned. We are conveners, we're monitoring the system of services, and we are serving as an advisory body. And I think there are multiple ways that we do that. And I think what's important to note is that it doesn't just happen at the state level. And I think that's what makes Vermont unique, is that we have this regional council structure that allows this feedback loop to happen. So when we are talking with the key partners, the people who are doing the work in Addison, we're able to then have this feedback loop to say, hey, state of Vermont, look at what's happening on the ground. It's so important to get that community voice. And I think one of the things we're working even more to incorporate is the voice of kids and families. So we've done it in the provider realm. We've got educators, we've got childcare providers, direct service providers, but we need to do a better job engaging kids and families.
What are your plans for doing that?
So we actually have grant funding, federal funding, through the Preschool Development Grant to really focus on family engagement, maximizing family choice and engagement, and figuring out how we provide families an opportunity to lead. And one of the ways that we're planning to do that is by by hiring parents directly into regions to say, you know, can you help us elevate different family voices? How do we best engage families? You're the experts. How do we get to families? How do we make sure they're included? How do we make sure that that engagement's meaningful and that they feel like they not only are just engaged, but partners in this work? Because ultimately what we're doing is trying to support them. And BBF specifically is doing that at a systems level, but more specific, how do we make sure that families understand what that system of services is, and how do we support them in most effectively navigating that system of services?
So could you talk, how did you come to be doing this? Like, is your background in early childhood? Is it in education? We know that you were a fellow at Harvard for a while.
Yeah,
We'd
so
love to hear that.
So I started. So I'm originally from Rutland. I think it's important to say that I'm originally from Rutland,
Okay.
and I have not been in the state of Vermont for 16 years. I've been pursuing different higher education opportunities, and I really started it as a direct service provider. I was providing respite care and worked in a preschool setting for a little while, primarily working one-on-one with families of kids with disabilities and special health care needs. So children with Down syndrome, autism spectrum disorder. And I was really loving that direct service provision, but I also had taken a couple of research courses and decided, wow, I think I could make a really great impact doing research to inform service provision. And so I pursued my master's in developmental and educational psychology.
So were you at VAC? Is that where you did respite care?
Nope, I was working both in Rutland and then in Rhode Island as a direct service provider. And then I pursued my master's at Boston College, and that was again in applied developmental and educational psychology. And as I was doing that work to understand how do we support families' well-being and what do we know about the services that help them, someone suggested to me that maybe I should think about going even broader and thinking about how we use data to inform policy. And so I pursued my PhD in social policy from the Heller School at Brandeis University. And there my research was really looking at the impact of early intervention on families and kids. So looking at the impact and the effect of home visiting and how that supports parent and child competence. And then interestingly, an opportunity presented itself to both work with Boston Children's Hospital, Harvard Medical School, and Mass General Hospital for Children. And I was a pediatric health services research fellow my last 3 years in the Boston area. And that work was primarily saying, we understand that the importance of early childhood. We get that this 0 to 3 period is so critical for helping support kids and families. What do we know about how families and kids navigate service systems over the life course, and how do we support them in effectively doing that?
It's so fascinating because a lot of the discussion, as you know, in Vermont right now is how do we bring these, to date, pretty much separate systems of healthcare and childcare and education closer together so that they make more sense for families.
Yeah.
I'm curious what you learned doing your research there.
Yeah, it's really interesting because one of my key projects before I left was understanding the transition from early intervention, so 0 to 3 service provision, specific to Massachusetts, but 0 to 3 to the education system, and how do we support families in that process. And that was really about interviewing providers and early intervention staff, as well as educators, around what were the barriers and challenges you faced in doing this? And a part of that absolutely was this siloed effect, right, of having different agencies lead Part C and Part B of the Individuals with Disabilities Education Act, right? So IDEA Part C being overseen in Massachusetts by early intervention, and the education system overseeing, or the health department versus the education department. And what we heard was, a part of it is the silos, a part of it is the communication and the integration of those, right? So how can we more effectively communicate both with families, but with the providers and the senior leadership to say, we're ultimately trying to do what's best for kids and families in our state. And that is the basis. And we have different mechanisms for how we choose to approach that, but that is the basic mechanism we're really working on to do what's best for kids and families. So kind of resetting our basic assumptions of coming to this work and then figuring out the concrete integration strategy. So how do we better partner? How do we develop those relationships, both at the state agency level and then the local level where this is actually happening on the ground?
And what are you finding in Vermont? What are your ideas? I mean, I certainly feel as if that challenge exists here as well.
Yeah. I think
Does
it's
it
similar.
seem different? You think it's the same?
I think it's similar, right? We see challenges partnering at the agency level, at the regional level, but we have a really incredible opportunity. We have universal pre-K implemented, right? We're working on it, and now I think we have an awesome opportunity to say what's working. What do we know about successful pre-K? What are the mechanisms that support successful pre-K? And how can we move that work forward? So I think that can happen at a bunch of different levels, and I'm really excited to be actively engaged in hosting forums across the state to understand that better.
BBF is hosting forums around universal pre-K.
We
the
are.
one in Addison is coming up.
Yes,
December
I'd have to
11th?
the 21st, I believe.
21st? November 21st.
So we at BBF are hosting, again, we're hosting regional forums across the state to help support the larger conversation about what success in U-Pre-K looks like at the regional and local level. So from the perspective of providers and families and educators, what do we know about what successful pre-K is looking like? What are the models? What are the mechanisms that you're using? Is it the relationships and the communication? Is it some sort of standardized protocol? What is it that's making that work? And how is that different across the state? And how is it similar? Where do we have consensus and where are we hitting roadblocks to move this work forward?
So what was it that drew you back to Vermont? It seems like being in Boston with Boston Medical and just all of those sort of high-flying places that influence policy, I would guess it would be hard to leave.
Yeah, it's interesting. I have absolutely appreciated my time. I actually missed my first step, which was being at the University of Rhode Island, and then transitioning to the Boston area for my last 13 years. And I truly loved and valued my experience there. But when my husband and I had our first baby, who is now 2.5, so Amelie, we just decided that where we really wanted to raise her and where we wanted to see our family grow and thrive was back in my home state. So we, for the last few years, have really been focused on what types of positions and what work would bring us up here. But it was really about wanting to raise our 2-year-old baby here and coming home.
To hear.
Yeah.
Is it working out the way you hoped?
It
Were you in a
is.
supportive community? Were you able to find childcare?
Yes. So
for you?
so it was incredible, and I will say my husband has a career that allows him to be flexible and follow my lead in this area. So he is the new head chef at Blue Northeast Seafood in Burlington, which has been an incredible opportunity for him as well, and I'm really proud of what he's been able to do in the last 5 months as well. And then from the family perspective, we were able to find childcare. I'm really feeling supported in that decision. Amelie's transition has been incredible. So we are all feeling like this was absolutely the right decision, and I'm loving my current role at Building Great Futures.
You probably know that everybody's totally delighted that you're here.
Thank you.
In this role. I'm wondering if there are things that you would like to talk about that we're going to run out of time, unfortunately.
No, that's okay.
That I didn't ask. Dreams for the future, or comments on. I think you just met with all of the regions a couple of weeks ago.
Yeah, I think what's important to note is that as I was coming into this role, I was really committed in spending time in our regions, and I'm still working my way across the state. I actually met with the regional council in Addison this morning, which was awesome. And I think that that's something that I'd like to continue to do annually, because I think it's important for me to have that direct touch. And we do have regional coordinators who support our council tables across the state. But I still think it's important for me as the executive director to be out in the communities and hearing firsthand what's happening. The other thing that I think is something I want to kind of really drive home is this idea of using data to inform policy. And one of the things I'd really like to do over the course of the next year is educate others about what data can be. And it doesn't always have to be that one number, but that we can use qualitative data and family stories to support that quantitative data. So how do we use data to inform service provision and policy?
I'm so excited to hear it. We're just talking about, at least for this county, starting a pretty robust educational program, and part of that will be how do you do exactly what you said. So maybe you'll come and teach for us. We'll see.
Yeah, I would love to.
That'd be great. I'm also wondering if your husband's working in Burlington, you're not in Rutland anymore?
Oh, no, I didn't mention that. So my entire family is still in Rutland, so we do spend quite a bit of time in Rutland. We also spend time on Lake Hortonia, so really down the street. My mother just transitioned. Actually, my entire family has transitioned their roles in the last couple of months. My dad is the new assistant facilities director at Castleton University, which is really awesome for him. And my mom is transitioning just this week, actually, into a new position in Rutland, in working in a front office staff as a front office staff member and support to an orthodontist in the Rutland area. But we currently are residing in South Burlington and are trying to figure out where we're going to physically land in the next couple of years. But that's where we started.
And BBF is still physically, your office is in
Williston.
Williston?
Yep. So we have a central office in Williston. Our coordinators are living and working across the state. So I am really working to embrace a culture of remote work, and how do we do our work effectively, both by coming together in person, but what are the tools that support our work across the state in the most effective way.
Great. Well, we're all thrilled that you're here, Dr. Crossman, and really grateful that you took the time to talk with me today. And for those of you that are watching, in a moment, Dr. Crossman's contact information will come up on the screen. We would encourage you to get in touch, check out the website. And I'd also like to mention that if you're watching and you have an educational program that you would like to share with a broader audience, it would be lovely for you to just get in touch with the station. These people can help you do whatever you want to do. They're kind of remarkable. So thanks.
Thank you so much, Cheryl.
Thank you.